Hi everyone, my name is Chris Elriegel and I am the Care Plus New Jersey School-Based Program Manager here in the Bergenfield School District. I'm sharing this recording today of a presentation that took place on February 22nd, 2021. And Ms. Jacqueline Gagliardo, who is the Director of Counseling and Support Services, was part of the session as well. We wanted to share this recording for everyone who is unable to make it, and we hope that you can still gather something important for yourself and for your family out of this recording. So just to start, I wanted to begin with a pause and thank you for being part of the meeting and this recording today and taking the time to view it. I know everyone's been really busy, been maybe permanently feeling like you're 5 minutes behind on your schedule at all times. And so we wanted to allow everyone to just take a pause and take a deep breath before we get going with the information that we shared with everyone. Jackie and I wanted to start with the concept of the good enough parent. It's a concept that came to my mind when thinking about how we wanted to support people within the district. The good enough parent is a concept that comes from psychology, and it puts forward that just as you wouldn't expect your child to be perfect, you don't need to be a perfect parent. When mistakes happen, we tend to blame ourselves. It's kind of an easy target to go back to, but we're all going to make mistakes. I always tell the students I work with, the point of mistakes is that we learn from them and we work towards decreasing them from happening in the future or not happening at all. So blaming ourselves isn't always the most compassionate or helpful thing we can do towards ourselves. So instead, I ask that you please respect and understand your child for who they are. You know your child better than anyone. Focus on the present as opposed to the future, and respect, reflect, and empathize, and remember your own mature skill set as the parent. I always tell everyone, you don't get a manual when you become a parent. You have to learn as you go, and no one has had to be a parent during a pandemic before. The pandemic's impacts are seen and unseen, and from speaking with some of the students in the district, they expressed some concerns about what they've been going through and what they wish their parents could understand. And I wanted to share a little bit about what to expect is, while unfortunate, normal to be seeing your child go through at this time. So with children, you may see difficulties with uncertainty. People, especially children, tend to thrive with structure and routine. And unfortunately, that's been very difficult to come by in the past 11 months or so. Concentration can be very difficult as well as leaving home. We've been told to stay home for safety for a long time, and that can make going back out into public difficult for a number of reasons. You may see increases in depressive symptoms. So you may see your child presenting with sad mood, maybe decreased energy or decreased motivation. They may appear more anxious or nervous. They may appear more restless, and they may be lonely as well. They've been cut off from a lot of the positive social supports, just as everyone has during this time. And for parents and caregivers, your mental health may be affected as well. Your child's mental health can affect your mental health because you obviously care about your child very much. So it's important to respect the way your child's feeling, but also respect the way you are feeling as well. Self-care may be out of balance. You may be trying to juggle multiple things at once, and that can make it hard for you to put aside some time to do something you enjoy. So I always encourage not only students, but parents too, to please take 5 minutes here and there, even if that's all you got, even if you have 3 minutes, to just check in, maybe try and do something you enjoy for yourself for that little bit. That can still make a difference. And you may feel increased stress too, increased difficulty with managing your frustration and anger. And while of course, that's not a feeling anyone likes, it is something that is normal. And if we can accept it as normal right now, we're going to be able to cope with it a lot better. And you may see different needs by age group. You may have children that are all within one age group or younger and older. Also, you may see children revert back to some older behaviors or younger behaviors as they're under a period of pretty intense stress. So with younger children, you may see the need for some increased presence. They may want to be around you more. They may seek more reassurance. Limited media, not just for little kids. I say that for older kids and for adults too. In general, even before the pandemic, I thought it was important to limit the amount of media we take in, but especially now, you can continue to take in so much information that can be really difficult on our well-being as well, because there is just so much concerning information that can be out there if you seek it right now. It's important to try and keep routine away from school as well. If kids know that they can consistently engage in hobbies or playtime each day or for a certain amount of time, that's great as well. And putting an emphasis on good behavior, positive reinforcement. We may not hit 100% and our best right now, as I'm going to talk about in a little bit. But that being said, when we focus on positive reinforcement, when we catch people doing right instead of doing wrong, it can have a really positive effect. And for young children, when we're describing what's going on in the world today, we want to go with fact-based and short, simple explanations. Whereas with adolescents, you can have a more open explanation maybe, and a more open conversation. But with adolescents too, you want to include them more in decision-making and in responsibility at home. You also want to make sure that they're engaging in ongoing peer support, staying in touch with their friends, even if it's just over text or FaceTime or something remote like that. And what we can do to help support children is a really important piece to look at, because even small actions can have important or big results. So as of right now, how we can help our children and ourselves is to remember that any improvement is better than no improvement at all. We may not be able to reach our best right now, and that is okay. We're under a lot of stress, but we can still put a good effort forward. So when I work with my students, if they went from a not so grade to a little bit better of a grade, I am immediately giving them lots of positive reinforcement to show them, here's what you did, you see the result, this is great, let's find a way to keep this up. You want to find structure and routine as you can. I understand it's difficult. I understand it's not going to be perfect right now, but we're going to try the best we can, and we're going to continue to keep adapting our structure as we go. As I said before, we should all be monitoring our use of media and how much information we're taking in. We want to make sure we're maintaining healthy sleep, nutrition, and movement habits right now. Those are 3 variables that can have a great impact on how we feel. And please maintain your social connections, just as I advised you to help your children maintain those social connections. Our relationships with other people have a really great and I think underrated value on our mood. And accept and ask for help when you need it. And a great quote down below that I have to give my intern Allie full credit for. She said, what helps you will help your children. So please keep that in mind. And motivation. I know a lot of students, and maybe you as well, are coming up against a wall with your motivation, but it's important that we continue to try and keep an open conversation going right now, just so we can normalize that it's a struggle, but we're finding ways to get through. So speaking with your children about how you have maintained motivation during this time, even if it's been difficult for you, I think it can be helpful to have that really human interaction together. Being flexible on how and where assignments are completed. So maybe your child wants to complete their work at the kitchen table, and at this time, try and be flexible with them, because then they are more likely to buy in to getting work done. Praising effort over talent. As I said before, if you're seeing any positive increases, we want to make a big deal over that and really support the actions of the child going forward. We want to check in to make sure students are not feeling lost or unable to manage expectations. I talk with a lot of students who are feeling a bit nervous to reach out to teachers, even though I know that the teachers want to support them. So sometimes it's just a matter of me sitting down with the student and saying, hey, here's what you can say in an email to the teacher, and that's okay. It's short and sweet and to the point, but gets your point across and gets you the help and support you need, and your teacher knows you're trying them. And encourage children by sharing examples of when they've already succeeded. This is concrete evidence of their capability. Hey, do you remember when that test was difficult earlier in the year? Hey, do you remember when you were nervous to go back to school, but now you're going in for a few days a week and doing great? That can give children a reflection of their progress, because people don't always realize the progress they're making, and it can really be beneficial to point it out to them. And reframe mistakes as opportunities to learn, as I said before. I wanted to share some resources with you that you can reach out to, not only during this time, but any time, that are here for your mental well-being. And I wanted to share my contact information, as well as Ms. Gagliardo's contact information as well, should you have any further questions. We let the parents who showed up on February 22nd know. We're happy to try and help where we can. So thank you so much for being part of this. Thank you so much for taking the time to view this recording. And please, as I like to say, take care of yourself, and please take care of each other. Thank you.